Alright, so we're actually looking at the standard that is actually set by the World Health Organization, and this is like related to preconception. So if you are going to take care of a woman before she actually even takes in, like, not take care of a woman, you're trying to like advise her, even take care of, you're also trying to give her all those, various hints she needs even before becoming pregnant. What are the things that you shouldn't miss out? Okay, so for the checklist, we said that you are trying to emphasize the important aspects, okay, that you should actually not miss out. So for medical and reproductive health, you are trying to see if this woman doesn't have these disease conditions. Okay, you are trying to review medications for safety in pregnancy. You are trying to access her reproductive history, that's her past experiences with pregnancy. Then you are trying to see if they have, like, all those disease conditions that can be spread between them and their children. You are trying to immunize and control infections. Okay, so you are giving things that will basically boost their immune system. They are screening if they have any sexually transmitted infections. Okay, so on what they are eating and their lifestyle, you're just trying to see that they are eating well. Okay, and of course they have started eating good levels of folic acid. Then you're also trying to look at the drugs. Okay, smoking, do they smoke, do they abuse drugs? So mental and psychosocial health, you are trying to see if they are depressed or anxious, or if there's any other mental condition. You are trying to access for their relationship safety, okay, and gender-based violence. Okay, so you're also trying to provide support for their stress management and emotional well-being. So the environmental and occupational risks, you're trying to look at if they are exposed to toxic stuffs, okay, radiation, chemicals. Okay, so timing and pregnancy planning, you are discussing their fertility goals. You're trying to educate them on contraceptions, and if she eventually takes in, she should know that after she gives birth, she has to like space it so that her body can rest, recover from the blows of pregnancies and all of that. Okay, so I think this is there are so many other things you might actually want to ask her, depending on how the patient is presenting and depending on the issues you guys face in your immediate area of service. But for these ones, there are things that you shouldn't miss out. Okay, so this one today, so counsel on workplace safety and protective measures, okay, where she's working, so have to advise on that.